All right, everybody, we're about to get started. Here to talk to us today about cultural considerations in the Black and African community. Welcome back to the stage, Telia Anderson.
Well, now I get to legitimately talk your ears off. No. As I mentioned, I am the owner and founder of Yassine's Love. I do culturally specific CRM supervising over at LifeWorks. I operate in the space of DONA's international president and so many other things. I do MMRC. I'm on the MMRC board, which is the Mortality Morbidity Review Committee. I serve on quite a few boards. It would behoove me to have my assistant up here to tell me, because sometimes I don't even know until the meetings come. But this is a curriculum I actually created years ago when I was working at Project Nurture in my office, and I started to see that there were certain things and ways that we needed to support families. I started to create this curriculum to be able to teach. I never ever would have thought that I would be standing on a stage for CareOregon to teach it. I always thought, thank you. I made it for the little, for the community doulas. If they needed some type of information, I host little trainings and I let them, I give them information on how to support our families that struggle with mental health and addiction. So the objectives, there it goes. Oh. Just know that I'm clumsy, you guys. If I mess up, just, cover your eyes. I'll gain myself. Objectives is gain an understanding of how doulas improve birth outcomes, develop a trauma-informed framework for working with birthing people with substance use disorders, but mental health as well. I came from the substance use aspect because I feel like there's so many supports for mental health, not just although in a Black community we need more, but there's a lot more prevalent support for mental health. Substance use disorder, of course we know about the criminalization of Black people around actively using drugs, and so that is the reason why I like to focus on it a little bit more. If you didn't know what a birth and postpartum doula was, these are the definitions, I think, from Webster's Dictionary. A doula is a woman typically without formal obstetric training who is employed to provide guidance and support to a pregnant woman during labor. Doulas provide physical, informational, and emotional support during the pregnancy, birth, and postpartum period. And as we always say in the trainings that I've attended, we offer PIE, which is PIE, physical, information, and emotional support. It's a good way, easy way to remember it. The benefits of a doula, if you do not know the statistics, I'm not a statistic person, but I know some people are, so I always try to add them in. 28% less likely to have a C-section if they have a doula, 31% less likely to use synthetic oxytocin to speed up labor, 9% less likely to use any pain medication, and 34% less likely to rate their childbirth experience negatively. This is information from the position paper on DONA International. Obstetric outcomes are most improved in intervention rates most dramatically lowered by doulas in settings where the women were not allowed to have loved ones present. Epidural analgesia were not routine when compared to settings when epidurals were routine. Intermittent fetal monitoring, heart monitoring, or electronic fetal monitoring was allowed. Even in those settings, we have better outcomes when they have a doula supporting them. There is a video that's a part of this. Kayla said that she would send it out with you guys, and it's basically, if you guys don't know about Dr. Jenny Joseph. Dr. Jenny Joseph, yeah, some people know her. This is the JJ way they talk about. Dr. Jenny Joseph is a Black doctor who is based out of California, right? California? Nope. Florida, okay. So I always get that mixed up. Florida, and she has a clinic that is basically trauma-informed, culturally specific. She has the highest birth rates, the lowest birth loss. She doesn't have any. She has low mortality morbidity rates, and she has fat babies, is what they call them, because when we are impacted by racism while we're pregnant, we have smaller babies, and I don't know if people know that, and so she has the what she calls fat babies. That link will be sent out, Kayla, and you guys can watch the video. On why it's so important and how it impacts the Black community. That's the video. Other things to consider. I change this all the time depending on where we are in the world because that impacts birth. We always think some things are outside and it shouldn't impact birth. But the political climate right now, you guys, the way that it's impacting pregnancy and birth right now is astounding. Actually, let's just go back pre-COVID. Let's go back pre-COVID and pre-ARRIVE study, because I don't know if you guys know about the ARRIVE study. That came out a couple of years before COVID. And so it seemed to impact pregnancy and birth in a dramatic way. We were seeing a lot more C-sections and inductions, right? So the political climate, you hear a lot of people, I get a lot of clients calling in, talking about they want to transition out of the hospital and deliver at home. I've had a couple of calls that people say that I'm going rogue, and if you know what that means, we have a lot of people that are afraid, especially within the immigrant communities. Undocumented people do not even want to come in and get checked. They do not want to come in and get a pregnancy test. They do not want to do any of that. So how do we support them? How are we going to show up for people like that? And what does that look like when we are supporting an immigrant? I always tell people that serve in the position as a doula or a peer, always make sure that your license stays intact. If a person asks you to attend a birth and they are not with someone that is a provider that is skilled, like a midwife, to catch their baby, you need to make sure you let them know you are showing up to support as a friend. You cannot support as a medical provider in that space, but you can support as a friend. And so just being there for them is really important right now. I know we have a lot of people that are like venturing away from medical systems. And so just keep that in mind when supporting a lot of our families. Domestic violence and interpersonal violence does increase in the postpartum period, 26%. And so we want to take that into consideration when I heard someone talk about postpartum doulas. I just was talking to Josh about some things that I have on the forefront as far as supporting people in the postpartum period. It is one of the things, when people ask me, what are one of the things that you struggle with in your organization? And it's the postpartum period. Our moms are struggling really bad with mental health. A lot of mental health. There is not enough peer hours between me and my other two doula staff. I think that we have 120 hours we can work. They are maxing us out on those hours because a lot of people need a lot of hand holding, and we have had people be readmitted for other health conditions that show up after they deliver. Postpartum preeclampsia. That is something that has been showing up within Black women. I always tell families that deliver that are any part of the BIPOC community, I always say, can you please buy a cuff? And if you can't, then we'll figure out how to donate you a cuff to check your blood pressure after you deliver. Even if you're just doing one day, every day, or every other day, as long as you're in your postpartum period, just be up on top of your blood pressure. Just because it's impacting them in different ways. Recovery relapse increases 80% in the postpartum period. Those of us that work in this work, we know that, right? When you start to see a client slowly pull away from their supports that they've had in place, or you start to see them engage in certain ways. Yes, we talked about our harm reduction earlier, but if you know you have a client that hasn't smoked cigarettes in a really long time and hasn't been concerned, but all of a sudden they're picking up cigarettes, they're showing signs of possible mental relapse. Please check in with them. One of the telltale signs is a mom that wants to stop breastfeeding. They've been doing amazing. And then all of a sudden she's like, I need to put the baby on formula. What's going on? Check in with them. I'm not saying enforce breastfeeding, but just check in with them. Because sometimes with that little check-in will help them reconnect and understand what's going on. Pregnancy-related suicide increases 62% in the postpartum period. And I have to tell you guys, between 43 days postpartum and 365 days postpartum, I will have to tell you, I don't know who all else is in here, but me and Deisha are in MMRC, and we both can vouch that suicide is definitely prevalent in the postpartum period. And I will say my frustration, and I'll get off my soapbox really fast. The reason why we're losing them is because we're not having conversations. Period. A lot of times when we go over those cases, they were not connected to a peer or a community health worker. And I'm like, what? You guys. That is the biggest thing. Talk to each other, you all, please, because the providers are not reaching out to the community and asking for these people to be connected to resources that may save their life. Just someone giving them a phone call, checking in and saying, hey, a lot of times these people let people know that they were struggling mentally and they still were not referred to some outside resource to give them the support that they need. So that is the biggest thing. When we talk about postpartum suicide, that is the biggest misconnect that we see. Oh, crap, sorry. Postpartum depression, sorry. Postpartum depression impacts 8 to 13% male partners. There's new studies where they are starting to they started to see signs that male partners are experiencing postpartum depression. We just talked about partners and how we don't include them. This is one of the reasons why I started including them. I started seeing it within, I have my own anecdotal information. I started seeing it within my organization. Fathers tapping out and not really wanting to engage, and I'm checking in with, but here's the deal. I wouldn't even know that if I didn't build a relationship with them too. If they were just at home being depressed and I didn't hear from them and I hadn't talked to them throughout the pregnancy, I wouldn't know that. But because I do talk to my partners, and when I see them start to back off and I check in, hey, how's dad doing? What's going on? And so just checking in with them about their partners is really important, because we're losing them too, you all. We're losing them too. What is trauma-informed? Trauma-informed care is a strengths-based framework that is grounded in an understanding of responsiveness to impact the trauma, that emphasizes physical, psychological, and emotional safety for both providers and survivors. And that creates opportunities for survivors to build a sense of self-control and empowerment. I said it earlier, a lot of the people that we support that have trauma, at some point they were silenced. And a lot of times people are just fighting to get their power back. And so we want to keep that in mind. Strengths-based approach is what I come from. Whatever things that make them happy, that get their lights going, we come from that space. Whatever it is that's on the forefront of their mind that they need to take care of. Yes, they're pregnant. Yes, they need those supports. But if I have a pregnant mom that's stressed out about housing, I want to support her in that process, because guess what? That stress impacts that pregnancy, right? So we want to make sure that we are giving them wraparound supports. Again, if you are a doula and this is not your scope of practice, pass them along. If you leave this room today without numbers and connections, you have missed the point. You have missed it, right? Walk around this room, talk to people, and make connections. It's going to save our client's life, our peer's life. That's what we're talking about. We got to take ourselves out of it sometimes. I know a lot of times we want to disconnect because of the messenger. We may not get along with that person. We may not agree with them on certain things. But who's to say that they won't have the very skill needed to support someone? Right? It's not about us. Key principles: safety, trustworthiness, and transparency. We talked about the transparency this morning. That is very true. I've never made a DHS call without my peer sitting next to me. Never. Even with them kicking and screaming. I've had them, you can make the call and I support you, or I can make the call and you can sit here and hear what I have to say. Is it the first call I make? No. but I want to keep babies safe too, right? I will try to give them resources as much as possible, but when I see a family declining in a way that can be dangerous to the children in the home, I definitely will. I will let them know these are the concerns before I call, and then I'll give them an opportunity to correct that behavior. And if it's not, then I will remind them, hey, this is dangerous. This is scary for babies, not just me. Scary for the babies in the home. And so just talking to them about it. And then talking them through the process of what may happen. I've been doing it long enough that I kind of can DHS does not have a protocol, but they do kind of, right? They do have something that they have to go by. Trustworthiness and transparency is important. Peer support, I'm going to scream that from the mountaintops, because honestly, that's what brought me to this space, you guys. I wouldn't even be a doula if I wasn't a peer first, right? Collaboration and mutuality. Again, I'm going to say, leave this room with some numbers and connections. Do not leave here empty-handed. Is someone in here that can serve somebody that you're talking to right now? Believe it or not. Connecting, and I'm in recovery. I work a 12-step program, looking for the similarities and not the differences, you guys, within your community. Don't pick a person apart because you don't like the way they dress. It has nothing to do with peer support. Connect with them on that level. Empowerment, voice, and choice. Informed choice is something I echo within my practice. I always say it to my peers that I support, but also giving them their voice and their choice back. Letting them know the spaces that they can stand in and advocate for themselves. I don't know if you guys have experienced that within my own community, a lot of times the people that we support, the trauma is so deep here within the Black community alone that it's hard to get them to advocate for themselves. They will turn on you sometimes because they're afraid. They've had their families ripped apart, and being inside of a system scares them. And so they go into survival mode a lot of times. We need to make sure that we are there to remind them of how important it is to advocate for themselves and how you are willing to advocate for them until they can do it for themselves, right? But just let them know that they have that ability. I had a young lady that reached out to me. She said, I don't want my provider. He doesn't hear me. And I was like, let's talk about it. And she brought up some good points. And I said, listen, I am not the type of person, or am I a practitioner that can tell you, leave your doctor. But listen to your body. If you are saying that you don't feel safe with that person, that's all that matters. Move on. You can find another provider really easy. If you feel like you need to say to them, hey, this is how I don't feel safe and they fix it, so be it. Have a talk with them. Maybe they don't know. Sometimes providers don't know. They're just going through the rigmarole. And listen, they're humans. You don't know what they came out of that morning. Maybe their toddler was throwing Cheerios at their head. We don't know. They're human too. So have a conversation. I always tell my peers to this teaches them how to advocate. When you teach them how to have conversations with providers and nurses, this is laying the groundwork, the foundation for them being able to advocate for themselves. If you need to sit in the space with them, I've done it. You want to put me on FaceTime? Yeah, if I can have you on FaceTime while I talk to them. And then they come out and they were like, that wasn't even as bad as I thought. It wasn't. You just needed the support, right? Cultural, historical, and gender issues. Pay close attention. And this is something that I did not know for a really long time. I'll speak to the gender issues as a mother of a rainbow kid. That's what I call her. And my rainbow baby came out when she was 12. And she didn't care who accepted her, right? I am not part of the LGBTQ community, but my heart goes out to those that are of color in that community because they are still ostracized in a lot of ways. My baby, she presents masculine. And so when she decided to have a child, because her idea throughout her life was to have her partner give birth to their child. But that didn't happen. She decided to carry her own child. and the ridicule that she got from her own community was ugly. The disrespect that she experienced as a gay person that presented masculine in open spaces, to the point that my daughter made a tag and put it on her when she was at work: do not touch my belly, do not ask who the other parent is, and it is none of your business. Because they would always say, where's dad? Automatically assuming. You get what I'm saying? So just when you're supporting people with different gender identities, tap in, make sure you understand who they are. Because although she presents masculine, my daughter is still she, her. She always says, I know what God gave me down there, and it ain't changing no time soon. You know? And so you have to actually have a conversation with them and figure out where they identify and how they fit and be able to support them. Historically, you guys, I just had my historical mind blown. I went to the Mothers of Gynecology conference, and it connected back to history, the nanny midwives, and how deep that was. I've always read different stories about it, but not really understanding the historical trauma of what has happened within my own community in the birthing spaces, right? If you are someone that is non-black in any way and you want to work in this space, educate yourself. Do not come into this space and expect us to educate you. We're tired. That's all I'm going to say. Cultural identities, make sure you understand. When I say cultural, we think me, I'll say me, not we. When I thought culture, I was like, oh, like me being Creole, that's culture? No, there is a homeless culture, the homeless population. That's a culture. There's different cultures out there. Getting to understand and know them. Me and Katie were just sitting up here laughing and joking about how, not in a negative way, but just how they have their own language within the homeless population. They have their own families. That's not on paper as family, biological, you know? So just make sure you understand that about them. It makes a lot of sense. The 4 R's, key assumptions: realize the impact of trauma and how it can affect families, groups, organizations, and communities, as well as individuals. Recognize the signs and symptoms of trauma in clients, families, staff, and others involved with the system. I will say this is big, because a lot of times when we're working in a space, we think that everybody can manage themselves because they're professionals, right? But again, we're humans. And a lot of times they come into that space and they get triggered by things that happen, and you see providers even have a hard time. Don't judge them. Don't look at them different. Look at them as human. A lot of times I've stepped outside of a hospital room with a provider and checked in with them. Because if you're going to support my peer, my person, I need to make sure we're here. Like at some point, connected, some kind of way. We're supporting one person. I don't want it to be chaos in a room with somebody that's struggling with internal chaos. Right? And so if I see a provider having a hard time, can I talk with you? Or stepping out and waiting until they come out and, hey, can I chat with you for a second? A simple conversation can go a long ways in supporting someone. So understanding that. Respond by fully integrating knowledge about trauma into policies, procedures, and practices. Resist re-traumatization. Actively seek ways to prevent re-traumatization. I talked about a few. I just talked about it in the LGBTQ community. I talked about it earlier. When you feel like you don't have the scope or the lens to support a client or a peer, pass them off. If not, you will probably re-traumatize them. You will probably traumatize them trying to figure it out on their time. You know? So just make sure that you are connecting people with someone that better suits them. Don't take it as an interesting project. We are not guinea pigs, and nobody wants to be a case study for you, right? And so we need to take that into consideration. A lot of times I hear people say, oh, this person, she's having twins and blah, 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 and I want to be there. And I understand that. That birthing high, we want to be there. We want to see that baby come earthside, but we also want to see that family continue to grow and heal after that baby comes birthside, right? Perinatal mental health and addiction. When women with substance use disorder become pregnant, they need a high-quality, supportive model of care that meets their needs for pregnancy and postpartum care with wraparound services, breastfeeding support tailored to their needs. Some of our moms, especially those that have a C-section or are on a medication assisted, sometimes they have babies with a challenging latch, And it's just because of those things. And you need to be educated about it so you can support them. Engagement and support around recovery and mental health stability efforts. Peers who understand the road that they are on, have lived life experience. Help with other life issues like housing, relationships, child welfare, and legal issues. Being able to give them resources. Provide resources that are actually implemented. Because one thing that I see that people will give out a resource that's no longer really available, that's overwhelming to a client that's struggling and trying to get help. When they call numbers and they're no, make sure your resource list is updated often. And make sure you're giving out, I call mines every now and then, hey, do you guys still provide so-and-so? That is how I do that. Postpartum differences when dealing with addiction and mental health. Some birthing people experience psychosis or PTSD during labor, during labor and or birth that is triggered by changes that happen within their body during labor or birth. This has happened to me a few times. I've had someone check out during labor. Just check out. And you're thinking, you can't check out, we got to push a baby out, But at the end of the day, you have to figure out how to get them back into their body and keep them grounded and in that space. And a lot of times it's a lot of hand holding, a lot of reassuring. I remember at I think one of my most severe cases, and her fixation was having this pillow. And so I had her mom go and get the pillow from her house to help her to be able to sit in that space and be okay. And it actually brought a lot of calm into the room because it was a lot. But just being able to understand them before we get into that birthing space, especially if they identify with having previous mental health or anything like that, you want to make sure that that is something that's a part of their birth plan, right? You want to make sure that it's in there. Anxiety may also be present due to the change in birthing and postpartum spaces regarding COVID-19. This is around COVID-19, but now the political climate and a lot of other things that are impacting us. Sometimes pain or medication offered for pain during labor can be a trigger for people suffering from addiction and or a history of trauma. Be mindful. Not everybody that comes in automatically wants the highest pain medicine. Some people that have a history of heroin or opiate use or anything like that, sometimes they opt out of those things because they know it can be a trigger for them. Understand it. I remember standing in a room with a doctor that insisted that my client that had opted out of having opiates, he was like, your body's not going to heal, blah, blah, blah. I hear you. I understand. That is a true statement to some degree. But if this person is saying that is going to inhibit them, I think that is more of the harm reduction approach, right? Is by giving them the opportunity to say, hey, I can't take those. And if for some reason there needs to be a plan in place, a pain management plan or an agreement, then let that be a part of the intake or the birth plan. Try to keep them focused or grounded during labor, pushing, or birth. We know that naturally. After birth, check in with them to offer an opportunity for them to process their birth story. What I learned when I was a new doula is I would be in a birth space and I'd be like, oh my God, that was crazy. That was traumatic. I go home and I need to process and all of these things, and then I go talk to them and they were like, it was amazing. What did you see? Because I didn't see amazing. I came out of there and I had blood on my shoes, and yeah, it was kind of like I was in an exorcism. I don't know. That didn't, but that just goes to show that their lens is different than yours. Their experience is different than yours. Please empower their experience, not your own. Because if I had stood in that space and been like, girl, I don't know how you did that, she'd have been like, wait, what? And I might have traumatized her, right? So listening to their birth story, giving them the opportunity to tell the story, even if it's traumatic, what I've learned is a lot of times they feel really good to get it out, to talk about it, to feel heard and seen, to feel valid in how they felt in their body. And so that my first postpartum visit, that is what we do. We talk about the birth story. How was your birth? What is your birth story? What did you want to talk about it? And usually a lot of good things come from that. Remind them of the resources you discussed during their birth plan. Tap in with them. Constantly say, hey, how's that going with so-and-so? Or how's that going? Sometimes you might need to reach out to places because agencies they're busy too. Hey, my client reached out to you and they're just wondering if, just check in with them about that. Remind them of their support, their family, their people, their community. Where are those people and are you connecting with them? Compared to pregnant women without substance use disorders, these women are more likely to have experienced trauma in their lives. 35% of them were in foster care themselves. 77% of them dropped out of school at some point. 51% of them were physically abused as children, and 47% were sexually abused as children. This is connected to a link, also a video of my I want to say Dr. Crush, she's one of them, Dr. Nadine Burke, and she talks about ACEs, adverse childhood experiences, right? And she talks about how it impacts our health and basically it's a little bit of epigenetics, but how it impacts us as a whole, right? Our childhood experience, the trauma that we experience, how it affects our physical health too, right? Because we have increased chances. When we have high ACEs score, we have increased chances of hypertension and high cholesterol and other underlying health conditions, right? And so we want to take that into consideration. I'm not telling anybody to go and do ACEs score tests on their clients. Do not do that. Do not. You might open them up. I don't even suggest that you do it unless you're sitting in a good space, right? And you're okay with yourself. Because I don't know about you all. When I did it, I was like, oh my God. Dr. Nadine Burke. She also has a book out called The Deepest Well. She's actually incorporating African Americans into this because when the ACEs was created, we weren't considered. And so now she's adding that to it, which I think is amazing. This is the trauma tree. I think I heard Katie or someone speak about underlying things that come up for our clients. And so I like the trauma tree because it always has the root issues: previous trauma, maternal damage, baby and neonatal. Those are root issues, and then they show up as depression, insomnia, PTSD, right? I like this trauma tree because it's kind of a graph I can go to if I talk to someone of where it might go for them. If they have a baby, an infant loss. A lot of times when people have infant loss, they're told it's a chemical pregnancy, and they're treated as if wasn't even a baby, when in their mind they were preparing for a life, right? And so being able to support, I've had people that have become pregnant and they're having their rainbow birth, and they are more stressed about the baby that they lost than concerned about the one that they're carrying. And so being able to connect with them and help them process the loss so they can be in their body with the one that they're pregnant with right now, right? That's really important. Reach out to the community that you work in for mental health and addiction resources. What can they offer a pregnant person? Do they offer peer support for pregnant people? How long can they work with your client? Is it a year postpartum, 2 years postpartum? These are the things we want to ask our resource list just so we can have that information available for our clients. What treatment facilities accept pregnant people? If your person is on MAT, what resources are available for them? Because we know it's a little bit different when they're on a medicated assisted treatment. As always, I'll keep saying, make a resource list, keep it updated. In the recovery community, we often say that addiction is the symptom of an even deeper issue. It's just a symptom. I don't know, I will be a little bit transparent in this moment. For me, I was trying to silence the men that took over me when I was a little kid. That's what took me into addiction. So when I think about my story, I think about how I know I'm not the only one. I'm not a unicorn, right? I know that I'm not the only woman that experienced that and tried to silence the trauma, right? And so when I connect with people, I take that into that space. That's that lived life experience, and it gives me the ability to have empathy, to connect with them when they talk about different types of trauma that has happened and how it's impacted them. And then let's talk about like when you started using, right? Sometimes they will, sometimes they won't. Knowing a person's story is really important. It is a given that trauma intersects with mental health and addiction. Be mindful of this when supporting a birthing person. Address any biases you may have about mental health and addiction. We can sit in this room knowing that we work in this space and say we don't have biases, and we would be lying, right? Because we all have biases. I would say mine's out loud. I was like, I do not want to work with people that are with a client that's experienced DV, because I'm going to go to jail, right? That's how I thought. But after I was trained and I was taught to look at it from a different lens, that's like what I love to work with, because I know those families kind of get brushed to the side and overlooked. And so just addressing our biases. Be willing to, sometimes we don't know them until they're triggered too. So I won't judge a person that say, oh, well, I don't think I have a serious bias, but sometimes we don't know until we're in that space and we're triggered by that bias. Be willing to meet them where they're at. Make self-care a priority for yourself. We do heavy work. I say, I don't know about anybody else in the room, but for me, doula work is spiritual, and to me, that's deeper than physical. It's spiritual work. Self-care is a priority. Keep yourself at the forefront. We are such caretakers and caregivers that we will forget ourselves. Even if you need to stop and paint your toes. Even if you need to just, I have dogs, you guys, and I probably overdid it during COVID. I have a lot of dogs now. Right? I love every last one of them. Every last one of them. I have 8. I have 8. And 6 of them are XL bullies. So you can only imagine, right? But I love coming home to them, you guys. Like, at the end of the day, they don't ask me for nothing. You know? They just be happy to see me. They don't care if I come in with my hair messed up. They not looking at me. They not stopping me at the door and asking me for a glass of water. They just want to be pet. And so that is my self-care some days. Some days it's just coming home and being in that space. The other thing that I took with COVID is playing. I probably took I told my friend after COVID, I said, I think I need to go back and have my therapist. I think I might be ADHD. I don't know. I had dogs and plants going on during COVID. I don't know. And thank God I didn't kill any dogs. I killed quite a few plants, though. If you are unable to do away with any of your biases, offer them alternative support. Have an open mind when you're supporting them as well. If you know that if you know that don't take on a project that you know you can't handle. Seriously, because what I've learned is sometimes it can be detrimental to us, right? When it's something that we can't handle. What is the goal behind this approach? Engage and build trust. This particular community is least likely to have doula support, but need it the most. Having a supported birth not only gives them hope for a different experience, but starts the healing process for the entire family. When we first started doing Project Nurture, we used to have these steering committee meetings, and I never forget, Dr. Blanca said, "What is the ripple effect, Talia?" We were in the room, and I was like, "What? Why would you pick me out of everybody in the room, right?" I didn't know what it meant. And she said, "What is the ripple effect?" And I said, like, she told me, like, when you help people and they successfully complete Project Nurture and they are successfully parent, what is the ripple effect is, and hopefully I won't cry too much. I'm going to blame it on the blood moon that's coming, y'all, because I'm tired of crying. The ripple effect is you supported a birth of a mom that has never been able to keep any of her kids. And she's never birthed without any interventions. And you supported her to do both. She goes on to parent that child. Her parents see a change. They're relieved. They're not waiting on that phone call, right? Her other children who may not be in her life may be able to reconnect, depending on how it was, the case was closed. There are so many different things. Not only that, that person becomes a productive member of society. I tell people all the time, you guys better be happy that I'm sober because purses and wallets are safer now. Right? That's my truth. Like, a productive member of society is what you've helped them become, and they're not taking from the society anymore, they're giving to it. And so that is the ripple effect. The people that they encounter, 2 of my clients are in the room. And so to see them sitting in this room, to see them sitting in this room as providers, right? That's the ripple effect. So you just keep pouring out. I will share something, let me finish this and then I'll share it in the end because I'm almost done. Improve health and reduce costs. A lot of times they just want to feel heard and cared for. Offering support within the doula scope of practices is vital to them accessing the care needed. This cuts down on ER and clinic visits. A lot of times our clients go to the hospital all the time because they feel like they need to be heard. So a lot of times if you answer the phone or the text as a doula, you can answer a lot of questions that might not send them to the ED. That cuts down on a lot. I don't know how many times I've gotten a picture of somebody's panties in the middle of the night. Because what is this? You know? And I'll wake up and text back and go back to sleep like nothing ever happened. But that might have prevented them from panicking and running off to the ED, right? And so that's how it can cut down costs. Breaking intergenerational trauma. Many of the communities affected by trauma and suffering from mental health have endured it for so long that it's become a norm. A way through is something I always say. I often compare doula work to being a tour guide. What I've learned through the strength-based approach is most people know the route they want to take, they just need the support. A lot of times they know which way they want to go. Sometimes they know they don't even think that they can go that direction, right? And you just open the path for them. Many times, simple support significantly changes the family's outcomes, and not just concerning birth, but their family holistically. We have so much work to do, you guys. And I hope that something I said impacted you in a way that you walk away and you look at it a little bit different today. I'll close with this. My friend here, she said something. Me and Julie used to work on Project Nurture Team together, right? And when she first came in, she was way too fucking happy for me. I had been there too long. I had been there for 2 years. I had seen enough. I was exhausted, you guys, right? And I remember her sitting in our office one day. She was like, "We're like the little boy with the starfish." And I was like, "What?" She said, "Starfish, you know the starfish story." And she started telling me about this little boy who was on the beach and he was throwing starfish back in the ocean. The little old man came along and said, "Why are you doing that? They're going to wash back up." The little boy said, "If one stays out there, I did my job." I don't know about one, but like I said, 2 of mine are in here, right? Continue to do the work. You are needed. It's so many people that need the support and want the support and look for the support. Show them that there's support, right? Show them that there's support out there and that looks like them. Everybody deserves a doula that wants one. Everybody that deserves one wants one. That's all that matters. I'll open it. I don't know, Kayla, do I have time for questions and answers? Okay. I was looking all over. I'm blind, you guys. Any questions? Oh, it's a hand over there.
Hey.
I'm trying.
Hey, so I've been asking a couple people, and it might not be a question just for you, but for the whole room. I work for an outpatient, and I'm looking for outpatients that allow people to bring their babies or, have provided daycare. I've heard of LifeWorks, but if there's any other ones that are not residential treatment that allow the mom to work, maybe we can just put together a list here for everyone.
That's a good idea.
Hi, I have kind of a loaded question. You said something that brought me back to a situation that I've been in several times with parents in birthing rooms. You talked about taking a provider aside, right, and having a conversation. Do you have any suggestions for those of us that have not found our power as much as you have to find that, right? Like, how do we equalize that playing field? Because as a peer who is not a doctor, right, and I don't have a bunch of letters after my name, and I have a whole lot of lived experience, and I am a parent, and I am a person in recovery, but I oftentimes feel like I don't have the power to stand up to a provider or someone who I feel like has more power than me. And I know that there are other peers who feel the same way, right, doing this work. And so as a person who is in those situations, do you have a suggestion for a way that we can find our power in a way that you seem like you have?
Ooh, that is a loaded question. First off, what brought you here? Like, you came to this space for a reason. Don't occupy it in vain. I'll say that, right? You came to this space for a reason. With that at the forefront of your mind. And you say confidence. I don't think it's confident. I'm going to get a little woo-woo on y'all. When I walk into rooms, I know my people are with me. I know that. And the reason why I know they with me when I'm not in the rooms, right? And so building a relationship in whatever empowers you. I don't never tell anybody how to navigate spirituality or connectedness, but whatever speaks to you and gives you that courage. Sometimes it needs to be outside of ourselves, right? Because we've been through so much. The other part is I'm a 12-step. I'm a 12-step, and if you know anything about them steps, you can't lie about nothing. And that makes me work on me, right? And working on me has exposed me in ways like, how can I do this work and tell a woman, you shouldn't be with somebody that's bashing your head in, and I'm with somebody that's bashing my head in, right? I can't teach someone something. I can't give what I don't have. I cannot. I can, and it'll be fake. That's what I got in that area. Self-work. Work is what I've done a lot of that has helped me in this work. Self-work. Because what we see, we run everything in the world through our trauma filter, and that's how we see it, right? And when you work on that, it clears up a little, and you see it a little bit differently, and it gives you that empowerment and that courage that you need. Hopefully that wasn't a loaded answer. Hopefully. Uh-oh, I'm scared.
Thank you for telling me.
I was going to say, Josh, what kind of question?
I totally apologize. I wanted to answer it just from a provider perspective, so it wasn't directed towards you, but as a provider, we're always stressed and behind and sort of worried about what we're supposed to be doing next. And I think sometimes what we're looking for is an easy path. And if you're seeing something hard, rather than say, this person needs this, say, hey, can I mention something that might make this easier? And as soon as you tell a provider that you can make something easier, they're going to be all ears.
Yeah. Thank you for that, Josh.
I have a bit of an answer, and I don't know if it's a right answer or not, but it's just an approach that I have, and I'm a little worried saying it to a room full of medical practitioners, but when I go into I'm a nurse, and when I go into a conversation with a doctor, whether I know them or not, I call them by their first name.
Mm-hmm.
I feel like it's a way to come on in an even field.
Mm-hmm.
And I know maybe some providers prefer to be called by doctor and their last name, but I just assume from the beginning of a conversation that a first name is okay, and I feel like it just starts us off on a first name basis, like you would with a peer rather than a relationship that is layered.
Mm-hmm, mm-hmm, mm-hmm.
So I wasn't sure if this was quite appropriate, but I was listening to the question that you asked, and it kind of put me in a path where I was thinking about the environment that I'm in and what I experienced when I first showed up as a person that's in recovery myself, ending up working in environments alongside, other providers. And what I know is, and I want to say this as peer supports and those that show up, that those of us that show up with lived experience, we got to know from the very beginning that we're coming with something that they may not receive in other rooms. That is the lived experience. We represent hope. Yep. So our ability to be transparent and show up as we are, and we all reach that at different moments in our own recovery. Sometimes we show up still finding our place in this world. But as a trauma recovery nurse of 17 years at Legacy Emmanuel, I showed up in a way that I shrunk down a lot, but then when I realized and I remembered what I represented as a recovering addict and the lives that I can change, showing up in that environment as a person who has experienced a lot of things that the people who are in those, trauma, mm-hmm. and what do we call it, rock bottom, sometimes can run hand in hand, as you show up in those rooms and showing up representing as hope. But what I wanted to say, what has helped me over the years is being who I am and living out my truth, and why I truly believe that I was there, because I knew I could make a difference. And that's sometimes hard when you're showing up in a way. It's gotten a lot better over the years, but in the beginning it was tough, mm-hmm. right? As a charge nurse, I never forget, there was a doctor who said, I was really big on the, opioids. It's different now because we talk about it in different ways, but back in the day, it was a whole lot with, a person's pain is what they say it is, and now we're responsible for what we created and all that. But back then, I knew that a person who was dependent on that drug, tolerance level might be at this moment, his leg is broke. Mm-hmm. Let's focus on the broke leg. And that didn't go well over the years. I had a trauma doctor, which I worked with, and he said, Melanie, you cannot save the world.
I'm going to try.
I won't say what I said after that. But we're going to keep on trying.
I will remind you, too, as peers, and then I'll close. I see Kayla. I'll remind you as peers, we are narrative disruptors. Stand in that. We're not going to make people happy. We are proof and evidence that what they say about addicts is not true, right? When we are proof and we standing right before them, how can they denounce that? We are narrative disruptors even when we're quiet, right? All we got to do is stand in that space, and we make some people uncomfortable. Just know that. It's not our business to take care of people. I always say, if you need a little bit of support, you should probably call your therapist or your sponsor afterwards, right? Thank you guys for letting me present.